A 25-year-old woman has Hb 8 grams per deciliter, MCV 70 FLL, ferritin 8 nanograms per milliliter. What is the most likely diagnosis? Iron deficiency anemia. Koilonychia is most specific for deficiency of which nutrient? Iron. Which anemia shows raised HbF, Tygart cells, and crew-cut skull on X-ray? Beta thalassemia major. Best investigation to confirm hereditary spherocytosis after blood smear? Eosin 5-maleimide binding test, flow cytometry. Parvovirus B19 infection precipitates a aplastic crisis in which hemolytic anemia, sickle cell disease. Painless lymphadenopathy alternating with night sweats and pruritus suggests which lymphoma subtype with Reed-Sternberg cells? Hodgkin lymphoma, nodular sclerosis, most common. The starry sky appearance on lymph node biopsy is characteristic of which high-grade B-cell lymphoma? Burkitt lymphoma. Which chromosomal translocation, T1418, activates BCL2 in follicular lymphoma? T1418, the 223q21. First-line tyrosine kinase inhibitor for newly diagnosed chronic myeloid leukemia? Imatinib. Philadelphia chromosome results from translocation between chromosomes 9 and 22. AML subtype with T1517 translocation is treated primarily with what differentiating agent? All-trans-retinoic acid, ATRA. Our rods on smear point toward which leukemia? Acute myeloid leukemia. Most common inherited bleeding disorder presenting with prolonged bleeding time and normal platelet count? Von Willebrand disease. Factor VIII level less than 1% with deep hemarthroses indicates which disorder? Hemophilia A. First drug to start in acute deep vein thrombosis before warfarin reaches therapeutic INR? Low molecular weight heparin. Heparin induces thrombocytopenia by antibodies against complex platelet factor IV, heparin. Which antidote reverses dabigatran in life-threatening bleed? Itarucizumab. Absolute neutrophil count, X over U liter defines febrile neutropenia in chemotherapy patients. Break time 400 milliseconds, 500 mu liter. Granulocyte colony stimulating factor primarily reduces which complication of cytotoxic chemotherapy? Neutropenic infections. RBC teardrop cells with massive splenomegaly and JAK2 V617F mutation indicate which myeloproliferative neoplasm? Primary myelofibrosis. What is the WHO cutoff for polycythemia vera, HB equals 0 grams per deciliter? Men equals 16.5 grams per deciliter. Hypercalcemia, renal failure, anemia, bone lytic lesions. Which single test confirms multiple myeloma? Bone marrow biopsy, showing greater than 10% clonal plasma cells. Drug of choice for induction in transplant-ineligible multiple myeloma, triplet? Bortezomib plus lenalidomide plus dexamethasone. Waldenstrom macroglobulinemia produces excess monoclonal immunoglobulin, IgM. Allocinaturia in a chronic smoker. First imaging modality of choice? Contrast CT urography. Tumor marker AFP is elevated in hepatocellular carcinoma and which germ cell tumor? Yolk sac tumor. Carcinoembryonic antigen CEA is primarily used for post-operative surveillance of which cancer? Colorectal carcinoma. Most common oncogene mutation in pancreatic adenocarcinoma? KRAS. Trastuzumab targets HR2/neu and is cardiotoxic. Which baseline test is mandatory? 2D echocardiography, LVEF. Tamoxifen increases risk of which gynecological malignancy? Endometrial carcinoma. Onion skin periosteal reaction on X-ray diaphysis of long bone in adolescent refers to which tumor? Ewing sarcoma. Best prognostic factor in diffuse large B-cell lymphoma according to IPI, age the 60 years. Superior vena cava syndrome in lung cancer, first emergency measure. Elevate head and give corticosteroids. Speak. Prosody rate 120%. Small cell lung carcinoma, paraneoplastic endocrinopathy causing hyponatremia. Break time 400 milliseconds. CIADH. EGFR mutant non-small cell lung cancer, first-line oral TKI, osimertinib. BRCA mutated ovarian cancer maintenance therapy drug class. PARP inhibitors, e.g., olaparib. Rituximab targets which CD marker on B cells? CD20. Sickle cell pain crisis, initial IV opioid of choice in emergency? Morphine. Hydroxyurea benefits SCD by increasing production of hemoglobin, HbF. Basophilic stippling in microcytic anemia implies heavy metal poisoning, classically, lead. In vitamin B12 deficiency, neurological deficit arises due to degeneration of which spinal cord tract? The posterior columns, dorsal columns. Schilling test historically differentiated B12 malabsorption due to lack of one factor, intrinsic. Mutation V617F activates which tyrosine kinase in polycythemia vera? JAK2. Warfarin inhibits vitamin K epoxide reductase. Which coag factors get reduced first, causing paradoxical thrombosis? Protein C and protein S. First sign of tumor lysis syndrome biochemically? Hyperkalemia. Others, hyperphosphatemia, hypocalcemia, hyperuricemia. Prophylactic drug superior to allopurinol in high-risk TLS? Resburicase. Our rods composed of abnormal fusion of which cytoplasmic granules? Primary azurophilic lysosomal granules. Hairy cell leukemia, specific TRAP-positive cells and massive splenomegaly. First-line drug, cladribine. Lab finding distinguishing aplastic anemia from pancytopenia due to hypersplenism, hypocellular bone marrow biopsy. G6PD deficiency hemolysis triggered by which antimalarial? Primaquine. Which direct oral anticoagulant specifically inhibits factor 10 and is once daily? Rivaroxaban. Clotting factor half-life shortest among I, 7, 9, 10? Factor 7. Massive transfusion protocol begins at replacement of blood volumes within 24 hours. 1 blood volume, approximately 10 units. Storage lesion in PRBCs leads to decreased level, causing decreased 2,3-PG, ATP. Myelodysplastic syndrome hallmark on marrow smear, presence of N-dot cells, ring sideroblasts. Lenalidomide treats MDS with deletion of which chromosome arm? 5q. Pernicious anemia patients have antibodies against gastric cells, parietal. Epotherapy target HB in CKD patients should not exceed grams per dl. 11.5 grams per dl. Metastatic bone pain alleviated quickly by which form of radiotherapy? Single fraction external beam RT. Non-seminomatous testicular tumors are sensitive to which platinum drug? Cisplatin. Cyclophosphamide hemorrhagic cystitis prevented by co-administration of Mesna. Anthracycline cardiotoxicity monitored by measuring cumulative dose and periodic imaging, echocardiography, LVEF. Drug that inhibits CTLA-4 to boost T-cell response in melanoma? Ipilimumab. Checkpoint inhibitor immune-related colitis grade 3 managed with high-dose IV corticosteroids. Which childhood cancer shows small round blue cells and elevates urinary HVA-VMA? Neuroblastoma. Tumor lysis prophylaxis hydration goal urine output, milliliters per kilogram per hour. 3 milliliters per kilogram per hour. Diffuse large B-cell lymphoma standard R-CHOP regimen contains cyclophosphamide, doxorubicin, vincristine, prednisone, and rituximab. Platelet transfusion indicated prophylactically when count is less than or equal to, and patients without bleeding. Seconds, 10 times 10 to the 9th power. Iron overload in thalassemia major monitored best by serum, ferritin, and MRI T2 star liver heart. Chelator used orally for iron overload with cardiac deposition, deferricirox. Langerhans cell histiocytosis cells are positive for CD1A and antigen. Langerin, CD207. Recurrent mucosal ulcers and neutrophil count 500 microliter define which inherited defect of neutrophil elastase. Severe congenital neutropenia, Kostman. Paroxysmal nocturnal hemoglobinuria is diagnosed by flow cytometry absence of which complement regulator, CD55 and CD59. Eculizumab mechanism, monoclonal antibody against complement protein, C5. Multiple punched-out skull lesions without sclerotic rim are typical radiology of multiple myeloma. Primary CNS lymphoma in HIV is almost always associated with which virus? Epstein-Barr virus. Helicobacter pylori eradication cures most cases of gastric cell lymphoma, MALT, marginal zone. Neutrophil alkaline phosphatase score is high in leukemoid reaction and low in CML. Dry tap marrow despite pancytopenia suggests early BAG. Myelofibrosis or aplastic anemia depends on context. Methemoglobinemia turns blood chocolate-colored and is treated with IV methylene blue. Which antidote counters 5-fluorouracil overdose by supplying reduced folate? Leucovorin, folinic acid. Osteosarcoma produces which serum marker elevated in 40% cases? Alkaline phosphatase. Bence-Jones protein is monoclonal-free light chains in urine, kappa or lambda. Diagnostic test for aplastic anemia, marrow cellularity less than 50%, break time 400 milliseconds. Best predictor of ITP response to steroids, age to less than 60. c-MYC overexpression in Burkitt lymphoma caused by T814, mouse gene next to immunoglobulin, heavy chain promoter. Definitive therapy for congenital hemophilia A with inhibitors high titer? Emicizumab, bispecific antibody. Hyperviscosity syndrome in myeloma treated emergently with plasma exchange. Nodular Brodsky port wine stain with glaucoma suggests risk of which leptomeningeal angiomatosis? Sturge-Weber, though not Haem-Onc. GVHD prophylaxis in matched sibling transplant uses calcineurin inhibitor plus short course methotrexate. Busulfan conditioning causes pulmonary fibrosis nicknamed lung. Busulfan lung. ABO-incompatible minor cross-match reaction manifests as hemolysis, delayed extravascular. HLH, hemophagocytic lymphohistiocytosis, shows ferritin equal to 200 nanograms per ml. DIC in acute promyelocytic leukemia mediated by release of granules, procoagulant tissue factor. Atherosclerosis protection paradoxically seen in which lipid storage disease with LDL receptor mutation? Familial hypercholesterolemia, not protected. Correct disease, none, skip. TTP pathogenesis is due to severe deficiency of metalloprotease ADAM TST. First-line therapy for TTP, daily tightened exchanges, plasma. Sweet syndrome, acute febrile neutrophilic dermatosis may herald relapse of which leukemia? AML. Chemo regimen BEP, bleomycin, etoposide cisplatin, is standard for which cancer? Testicular germ cell tumor. Ostsplenectomy blood smear shows Howell Jolly bodies, prophylaxis lifelong vaccination against which organism group? Encapsulated bacteria, Streptococcus pneumoniae, etc.